Hey, what's up? Dr. Joey Seaports here, and today we're tackling one of the most common shoulder problems, rotator cuff tears and pain. If you're tired of dealing with that nagging ache and you want to get back to lifting, reaching, and living pain-free, this video is for you. And the best part, we're going to show you how to bulletproof your rotator cuff in 5 easy exercises without surgery. Let's dive in. Before we jump into the exercises, let's take a second to understand what's going on with your shoulder. The rotator cuff is made up of 4 muscles that surround the shoulder joint. These muscles help with lifting, rotating, and stabilizing your arm. When these muscles get weak or injured, they're left with pain that can limit your daily activities and also activities in the gym. Now here's the thing, surgery might seem like the quick fix, but it comes with a long recovery and a lot of risk. What we've seen with many of our clients is that with consistent rehab, strengthening, and mobility work, you can prevent surgery and get back to your normal routine without that constant ache. Rotator cuff tears are fairly common, especially as people age. Around 20 to 30% of people over the age of 60 are estimated to have a rotator cuff tear. However, many people may not experience symptoms or significant pain from the tear, making it undiagnosed. The prevalence increases with age, with some studies suggesting that as many as 50% or more of individuals over 80 years old have a rotator cuff tear, often without any symptoms. Today, I'm going to show you 5 key moves that will bulletproof your rotator cuff and keep it strong. These moves are staples in our clients' programming and check the boxes for rotator cuff strengthening. First up, we have banded uppercuts. You can do this exercise standing or on one knee. Grab a resistance band and keep your elbows by your sides with your palms facing up. Create tension in the band, then slowly bring your arms out to the side. From there, lift your arms upward until your elbows reach eye height, and then control the movement as you lower back down. This exercise targets the back of the shoulder blade, an area where weakness is common in those with rotator cuff tears. Focus on smooth, controlled movement and complete 2 sets of 8 reps. I know you're struggling with shoulder pain and you obviously want to fix it, so text me the word pain to 720-710-4371 and I'll send you my free shoulder pain fix demo. Now back to the show. Next, we have the Subscap Punch. This exercise targets the subscapularis, one of the key muscles in your rotator cuff. Here's how to do it. Grab a band and attach it to a rig or door frame. Standing with your inside arm closest to the rig, you're going to start with your elbow by your side holding the band. Next, slowly punch your arm straight to the ceiling, keeping the arm in a neutral position and bringing your bicep to your ear. The subscap muscle is weak in those that have front shoulder pain. By completing 2 sets of 10 reps, we're making sure to keep the tension of the band throughout the movement to really engage this muscle. Next up is banded cheerleaders. You're going to keep that same band for this exercise and you're going to be targeting the upper back and rotator cuff together and moving in 3 different directions. To start, you're going to have your arms out in front with your palms up. First position is pulling the band apart to the sides. Then make sure that you can return to neutral and then move into a diagonal pattern with your arms moving opposite directions. Then return to neutral and repeat the opposite direction. All 3 positions equal 1 rep. Complete 3 sets of 5. This is going to be an upper back burner. Next up is banded extensions plus external rotation. You're going to grab a circular band and put your arms behind your back with the band around your wrists. By creating tension by pulling the band apart, you're then going to move your shoulders into extension. This is targeting the back of the rotator cuff into that external rotation position, completing 3 sets of 8 reps of this exercise. Last but not least, we have angels over cones. For this exercise, grab objects to lift your arms up and over. Place the objects in 3 different areas as you can see, then lay on your stomach and lift your arms up and over these positions, making sure to move slow and controlled. This is targeting the low, mid traps, and also rotator cuff together. Down and back equals 1 rep. Complete 3 sets of 5 of this exercise. And there are the 5 exercises for rotator cuff strengthening that will keep you off the operating table. These exercises focus on providing stability for the shoulder, and although they are beneficial, They are not the long-term solution for your shoulder pain. If you're looking for help and you've tried physical therapy, injections, or even surgery and you're still having pain, then text me the word pain to 720-710-4371 to get a tailored step-by-step approach on how to permanently fix your shoulder pain. Our mission at Comeback Performance is to help over 1 million people around the world eliminate their shoulder pain, avoid unnecessary imaging, injections, and surgeries, and get their lives back. After you reach out, please like and subscribe to the channel. We're putting out daily content based on your guys' questions on shoulder-related topics regarding pain and rehab. At Comeback Performance, the comeback is always stronger than the setback.